Welcome to Nursing School Explained, and this video on the tidbits of CPR guidelines for infants and children. Now, when I taught pediatrics, I always went over this with my students before the first pediatric rotation because I think it's very important to know this. And some of you, although all of you have taken, or it is a requirement to take the CPR course before you start nursing school, but some of you, it might have been a while and you get so busy so you forget. So this video is targeted to kind of review the most important details about CPR so that you can be confident when caring for infants and children in the clinical setting. And who knows if you're ever going to need to use it in your personal life or just out on the street as a bystander. Let's hope not, but it's always better to be prepared. So these tidbits are based on the 2020 American Heart Association guidelines. And so when we first encounter a patient who is unresponsive or who we suspect doesn't have a pulse, we need to perform a pulse check. And that pulse check should be taking us about 5 seconds, but no more than 10 seconds. And for infants and children, the pulse locations are a little bit different. So for infants, because their necks are a little bit thicker and their thighs can be thick, so it's not really advantageous to check the carotids or the femorals. Many times we check the brachial pulse for a pulse check. And the important thing is that for infants and children, we do not wait until their heart rate is 0 or we do not detect the pulse at all. For infants and children, and this is very, very important, when the heart rate is less than 60 or there are signs and symptoms of poor perfusion, such as skin color changes, pallor, altered mental status, lethargy, any of those, or if you are unsure that you can feel a pulse or that is less than 60, start CPR. And the reason for the 60 beats per minute is because an infant's normal heart rate, normal resting heart rate might be anywhere from 120 to 160. So now they have less than half of that heart rate and they're not going to be perfusing well. So getting on that chest is very, very important to be able to keep that child or that infant alive. And the 60 beats per minute apply to both infants and children. Now, when it comes to pushing hard and fast, those are the terms I hope that you remember from your CPR course. So the depth of the compression should be 1/3 of the anterior-posterior diameter. So if you think about it, the front to the back of the chest, and then you take 1/3. So you should be compressing the chest about 1/3 of that diameter to get to the heart and be able to produce that cardiac output. And then the depth, the rate, just like in adults, 100 to 120 times or compressions per minute. Now, important here on little infants and children, we do not use both hands like we do in adults. We have to be a little less gentle because it takes less effort to compress that 1/3 of the AP diameter. So in infants, we do the 2-finger method, either like that, right between the nipple line, or in children, 1 hand. The other option for infants with 2 fingers is the chest encircling method, and you use both thumbs. As a quick review, refer back to your BLS book if you need a refresher on how to do that. Now, just like in adults, we want to make sure we allow for complete chest recoil and minimize interruptions to get that blood flowing, to keep it flowing, because what we're doing with CPR, we are taking over the function of the heart to perfuse the important organs, the brain, the liver, the kidneys, everything that we need blood flow to. And we want to change compressors every 2 minutes or sooner or if needed. So CPR in itself can be very strenuous, more so in adults than in children, but it is a very stressful situation. So in order to give the patient the best possible outcome, we want to make sure that the person providing the compressions is fresh and is doing them correctly. And don't ever be afraid to give feedback, constructive feedback, to anyone who is involved in the scene so that you can make sure that the patient gets the best possible outcome. Now, if you are using a BVM or a face shield or any kind of protective device to provide ventilations, the ratio for infants and children is 15:2. So that's a little bit different. And the reason here again is that little people, children and infants, have a higher oxygen demand along with the higher pulse rates. So we want to make sure we give them oxygen a little bit more frequently so that they can maintain the oxygenation of their important organs. And then we also want to get the AED as soon as possible and follow the directions. If the AED only has adult pads, do not hesitate to use them on children. Some AEDs will have children or infant pads and adult ones, but if all you have is adult ones, it's better to shock the patient and try than not to, and then they die. So those are the guidelines also. And then follow the instructions of the AED to a T. It's a very foolproof tool that tells you what to do, when to do it, and how to do it. And then certainly you want to wait until help arrives, which is hopefully already on the way. And these first responders, if you're out somewhere in the community or at your clinical facility, can help take over the care of your patient so they have, again, the best possible outcome. Please also make sure that you check my other video where I review the tidbits of the adult CPR guidelines so that you can be familiar with these very important rules and keep your patient alive, give them the best chance of survival. Thanks for watching. See you soon.